Alarms in Northeast went off when the first case of coronavirus or COVID-19 was reported from the region in Manipur on March 25. The number of positive cases went up to 53 in just a month's time. And while a man from Nagaland was tested COVID-19 positive in Assam, the state government is now preparing for the worst case scenario by upgrading the Naga Hospital Authority Kohima, which is the only district hospital in the state's capital, to a COVID-19 hospital.
Misinformation like COVID-19 spreads fast, especially in social media. This has led to an atmosphere of fear and panic regarding Nagaland's preparedness in battling COVID-19. We therefore decided to do a ground report from the Naga Hospital Authority in Kohima. The NHAK is equipped with 67 beds, 44 for male and 23 for female, 20 ICU beds with 9 ventilators. The hospital claims it has received 2,055 personal protective equipment kits, 1,195 masks, 12,300 triple-layer masks, and 1,180 bottles of hand sanitizers from the state government. The hospital has 500 staff members. There is a rotational quarantine plan in place. Should this team be overwhelmed, additional manpower will be brought from other districts.
If there is exhaustion of healthcare workers in the hospital, then our department should arrange manpower from other unaffected districts.
Each health worker, after working for a period of 7 days, will be quarantined at a government facility for 14 days, and even on being asymptomatic, they will be home quarantined for another 14 days. Following this cycle is mandatory for any health worker.
So we have something. How much is for 24?
After the health workers, they perform their duty. Normally, we are supposed to expected to work for 6 hours inside. For 6 hours, we are not supposed to come out. We wear the gown, we wear the complete, PPEs, and then we go inside. We work there, and after 6 hours only, this door will be opened. Okay. But before this door opens, we have to remove everything outside. Sterilize ourselves. We come out. Then we are not allowed to go home. So that is the protocol. So we work in this hospital for 1 week, 7 days, or 7 to 10 days, depending on the situation. But 7 days is what we have targeted. So for 7 days, all health workers, starting from doctors up to sweepers and drivers, they will have to stay in the hospital. And during that period of time, we need a place to stay. So for all the health workers, we are providing accommodations here. So they will not be allowed to go out of this campus. The whole campus will be cordoned off, and there will be security. So nobody will be allowed to go out, nobody will be allowed to come in. So that is including health workers. because it is the health workers who will create the maximum risk. So we have to ensure ourselves that we do not go out, and even if we come out from this place after 7 days of duty, what we are supposed to do is we are not allowed to go home. After 7 days of duty here, we will be taken to another place, another quarantine zone. So there are many quarantine zones that has been identified for the health workers. So we will be staying there for 14 days. During that 14 days period, they will observe us, and depending on our complaint, and samplings will be done on a regular basis. And after 14 days, if there's no problem with the health workers, then they are instructed to go home and stay there again another 14 days. They will not be allowed to mingle with the public. So this is the strict instructions and protocols that we are to follow.
Arrangements to ready the hospital on a war footing started on March 24.
Once we see inside, I'll show you the outside part, so you can take a picture. And even this gate that we have put before will be locked to the person. Only when the patient admitted and all that, then that's the time.
The NHAK will, however, only admit patients when the first COVID-19 hospital, the Ayush Hospital at Chedema, reaches its optimum capacity.
In March this year, the Ayush Hospital at Chedema was converted to a COVID-19 hospital with 28 beds, isolation rooms, ICU, general ward for both male and female, all equipped with essential requirements. It was the first major step taken by the state government.
However, all has not been well in the state's battle against COVID-19. Controversy stirred after videos and photos of moldy face masks and poor quality PPE dating back to 2007 surfaced on social media, creating panic among the people of Nagaland.
Fumigators, and sodium hypochlorite, hand sanitizers, gloves.
Dr. Sendimaran Aunok clarified that masks and protective gears brought in 2007 to deal with the H1N1 outbreak and was supplied to the hospital only as a stopgap arrangement.
I thought I'll take this opportunity to clarify. You can correct me if I'm wrong, but I wanted to show you. 2007. This is a 2000, if you see through the thing, it's in 2007. Yeah, this is 2007. This is the thing that was shown by our health worker. Now this, and of course this one, this mask. This is the mask, and they thought that there is actually a black foam here. A black foam is normally kept here. This foam, because of the duration of the, it fell off, and they thought that this was fungus. So this was where actually we thought we would like to clarify. And this whole thing was actually obtained for, I think you all know it was during the time of H1N1 illness. Okay, that was the time that this was obtained, and this was given to us recently. But this, we wanted to use it for mock drills, not for patients. So this is something that I wanted to clarify. I did not know that this thing had happened, so I thought I'll take this opportunity to clarify that this was actually used by personnel for mock drill. This is not for them. Once the patients start coming, then whatever that we have now, we will start activating. But if we give it now to the health workers, they'll use it up. And it can also disappear. And that is also one of the line of concern, that not because of anything, but as Dr. Tong had also mentioned, that there's an acute shortage of PPE all over the world. Okay, everybody's struggling. So we wanted to be very judicious in our approach as far as usage is concerned, and therefore today you have witnessed the stock that we have obtained, and the moment we get the patients, we are going to activate them. But till that time, we are to use for training purposes, for mock drills, for everything. This is what we use. So unfortunately, this was shown, and this created a big kind of false, impression for everybody. But I thought I would take this opportunity to just clarify on this point.
The new equipment will be used only when a COVID-19 positive case is admitted.
Only thing is that since the need of PPE or any equipment is much more in other states where the number of patients are much more. So even the government also, they are categorizing it in that way. But our government has been on a regular basis requesting. So it has been coming on a regular basis, and thankfully till now, whether the patients are here or not, the government is ensuring that the stock is filled up every now and then. So we are filling up the stock.
It's okay. I think this is for how they are going to take care. Yeah.
So far, only one case has been identified in the state and was referred to Guwahati Medical College and Hospital in Assam. 36 people are kept in facility quarantine, whereas 6,079 people are in home quarantine to keep the fatal virus at bay.
Just give it to the patient for dead bodies for this. Yeah, this is the place where it's a morgue. Yeah, so even those patients who have died, we have to treat them. So this is the preparation room before the relatives come and take them. So we have a protocol for that. So with disposal of dead bodies, that will be in accordance with the public administration also. So the hospital administration and the public administration, we will come together and then we follow the protocols. So this is a very important thing. But here we are not going to keep any patients, not because of anything, but we are not happy with the safety of the thing. So this is kept only for mobs, but the rest are all for patients.
To handle the worst case scenarios, the state has activated 10 COVID-19 hospitals, 130 quarantine centers, 352 isolation beds with 17 ventilators and necessary PPE kits in place. Officials of the state say that the state is well prepared and well equipped to fight the pandemic if the situation arises.
The clothes, the aprons of COVID positive patients will be washed. So this is a separate thing. They will not be allowed to take out their clothes outside.